Hello and welcome again for another episode of 8 Questions in 8 Minutes. And today we're going to be discussing the importance of supplements. And for that, we have with us Dr. Lillian Crags-Dino. Dr. Lillian is a clinical dietitian. She works particularly in bariatric surgery and weight management. She's based in Florida, and we're very happy to have her with us today. Hello, Lillian.
Hello, thank you so much for having me today.
Thank you for being with us on the show. So today we're going to be focusing on 8 clinical questions, and we're going to start with our first one. The first question is, what are the most effective assessment techniques to identify nutritional deficiencies in patients, and how can dietitians ensure accuracy in their evaluations?
Absolutely, thank you so much for that question. So one of the most important jobs of a registered dietitian is to do a nutrition assessment, and that entails many different parts. So the first part would be if you have their record, their medical record, that would be great, so we can have an overview of the patient and their problems. But once the patient comes in, we're doing many different things to have a patient-centered approach to care. Okay. So what we do is we'll do the obvious. We'll do the anthropometrics, which means that we're going to get their height and their weight. But I think what's essential in assessment is we need to do a lot more than just height and weight. We need to get body composition, because body composition is really the understanding of what that weight is to that patient and the health that it entails as well. So if we can do a measurement of their body fat percentage and their muscle mass, that's ideal, especially for goal setting. When a patient gets on a scale, sometimes it's kind of disconcerting. They'll see a number on the scale, but I try to explain to the patient that the number on the scale entails many things, right? Your skeleton, your bones, your fat, etc. So that's one thing we do. We assess their body fat and their muscle mass. Another thing that we do for the assessment is a visual assessment, a nutrition-focused physical exam. Yeah. And what that means is that we're doing a head-to-toe visual assessment, and we're also touching the patient. So what are we looking for? We're looking for micronutrient deficiencies that could be manifesting on the outside. We're looking at their hair, their skin, their mouth, their teeth. We're looking at edema. We're looking at their muscle mass and if it's wasted in any areas. Malnutrition is very pervasive even in patients that suffer from obesity. So even though you might have a larger patient in front of you, you can't assume that they're overnourished. They're actually malnourished. Yeah. So that's a really, really important component of assessing patients that come in for weight management.
All right. So let's move into our second question. How can dietitians individualize supplement recommendations to meet the unique needs of each patient, particularly those with chronic diseases like diabetes or cardiovascular disease?
Thank you so much for that question. I love that question. It just goes to show that when there's a patient in front of you, there is not one size fits all. There is not one diet that fits all. You have to have a patient-centered approach, which means that you're taking all the information that you gathered from their labs, their biochemistries, their nutrition-focused physical exam. You need to talk to the patient about what they're eating, not just from a 24-hour recall. If you can do more than that, that would be ideal. Also have the family members involved as well. And then what you're trying to do is find out, if you can, do they have any existing deficiencies? Because then you have to triage. You have to decide, okay, this patient is deficient in vitamin D. Let me take care of the vitamin D first. So you have to kind of do it in a stepwise procedure. And you can't overwhelm the patient either. So if you're throwing all these, interventions at them, they're going to get overwhelmed. So try to prioritize what might be the most important. So I think that's so essential. It's patient-centered care. It's based on the needs of that patient and the conversation that you're having with them. Motivational interviewing, very important. And you have to see the willingness of that patient to make that particular change. And if they're not ready to make that particular change at that moment, you need to go to the next thing.
Let's go to our third question. What are the key considerations for dietitians when evaluating the latest research and evidence on dietary supplements to ensure the recommendations are scientifically sound, knowing that there's a lot on the social media buzz there?
Yeah, excellent. I think one of the most important responsibilities for a dietitian, being that we're healthcare practitioners, is
Mhm.
that we have to practice evidence-based practice.
Yeah.
That does mean staying up to date on the current guidelines that are published by a lot of the professional associations. When you look at research, you have to look at the rigor of the research. You
Mhm.
can't just read one study and base your interventions off of that. You have to look at how the study was conducted. You have to see if the research was graded. If you can get a systematic review or a meta-analysis and guidelines have been put together, that would be ideal. So I always suggest to my fellow dietitians is go to the professional organizations of that particular disease state. So you
Yeah.
might go to the American Diabetes Association to see what the current guidelines are, or the American Society for Metabolic and Bariatric Surgery to see what
Mhm.
the published guidelines are,
Mhm.
and allow that to be the foundation of your evidence. It doesn't mean they'll take that as cookie cutter. You still have to adapt those recommendations based on what you're seeing with the patient. And again, it's about that individualized approach. But you have to have a foundation. You can't just pull things out of the air and make assumptions. But you need to really support your interventions as well through the research.
That takes us to our fourth question. What strategies can dietitians use to effectively educate patients about the importance of dietary supplements, including potential benefits and risks, to ensure informed decision making?
I love that. You know, patient education is my favorite part of being a dietitian because you're talking to the patient. You do want to see if they're understanding what you're saying. They're overwhelmed with many different things. So you have to see their level of understanding. That's one. Number two, you have to see their level of compliance. Are they ready to make certain changes?
Yeah.
And then take baby steps. You know, they're not practitioners. So you don't want to talk to them as though they're children, but you want to talk to them in a level that they understand. You might have to show them different labels of the supplements. You might want to show them why they need to take those supplements because we're not the food police. You want to explain to the patient why they need to take these things for their health or how it might benefit them. Because most people are going to make the right decision if they understand why they need to do something. So I think really just having a nice conversation with the patient, have an interaction with the patient, don't dictate to the patient, have it be interactive where they're actually engaging. Ask them questions, ask them to repeat what you said to see if they have that clear understanding. Use models, engage the patient because
Yeah.
when you engage them, they're actively, motivated into making those changes.
Let's move into our fifth question. How should dietitians monitor patients' progress and adjust supplementation plans over time to ensure ongoing effectiveness and safety? I know you addressed a little bit on that. If we can reiterate and build. Thanks.
Sure, absolutely. I think this needs to be a team approach. So as a healthcare practitioner, I work with the other, professionals in the field as well, including the patient in the center. So the more contact that we can have with the patient, the better. So if we can even have phone calls in between or emails in between so we can see how the patient is doing, that's wonderful because you have that subjective information from the patient.
Mhm.
So you're documenting that and you're doing interventions as that comes. But also having it to be formal is important too, having that objective information. So get their lab work done again, bring them in for follow-ups. The more the better, I think. As a nutritionist, I think that's the fun part of my job. If I can see my patients once a month, I would love that. But having some sort of contact with the patient frequently
Yeah.
actually shown in the literature to have better positive outcomes. But I think officially, if you can at least get those labs done periodically, if I'm making an intervention on a supplement, I want to do those labs again in about 3 months. Okay. You don't want to do them right away. You want to make sure you're getting valid information, but I want to do them every 3 months if I'm doing an intervention. Yeah.
Personal preference. So, which leads us here to addressing compliance challenges. In our sixth question, what are some practical tips for improving patient compliance with supplement regimens, especially for those who may have difficulties adhering to multiple daily supplements?
I like to call it adherence rather than compliance because
Mhm.
compliance almost indicates that I'm dictating to them what they need to do.
Yeah.
So the first thing that I want to see if they're having challenges is what is the reason for the challenge? to not stay on track with the intervention. It might be as simple as they didn't understand the instructions, so I might need to reiterate the instructions. Or perhaps it's, economic. Maybe I'm making a recommendation and they can't afford something and they didn't want to tell you in the beginning because maybe they didn't know, or maybe they were too embarrassed to tell you. So I have to find out what is the reason for the non-compliance or non-adherence, and don't make any judgments. You're there to help them. So once I find out what the root cause is of why they couldn't take something, maybe it's giving them stomach upset. Maybe they just keep forgetting. That's what's going to kind of motivate you to decide, all right, what are some strategies? And the best way to come up with strategies is have that patient come up with strategies. All right, so tell me what the challenges are. Okay, so what are some suggestions that we can come up with because you keep forgetting? What are some things that we can do? And you always use the word we, so it doesn't seem that you're just dictating to them. Because once the patient says, you know what, if I keep that supplement by my toothbrush, I'm going to remember to take it. Beautiful. They've made the suggestion, so they're most likely going to do it. So again, I think it's all in that patient-centered care and that patient-centered engagement. That's what I think is important to compliance.
Our seventh question is, how can dietitians balance the use of dietary supplements with promoting a nutrition-rich diet to ensure that patients receive comprehensive nutrition?
Excellent. I try to explain to my patients that the supplements are a very important part of a diet, but it's just that, it's the supplement. So I need to take a look at what their diet is and see if I can manage changes in their diet, because that's what's going to fit into their culture as well. So I'm going to look at their cultural foods. I'm going to look at their eating patterns. And once I assess their diet and see that it might be some deficiencies in their nutritional intake, if I can't solve it through food, then micronutrients and supplements are so important. So it's an adjunct to their diet. It's not a substitution to their diet. So I think we always first have to work on the diet as the foundation to help them with that, and then supplement where they can't get enough of what they need. Or supplements are very important if we're treating deficiencies, because if a patient already has a micronutrient deficiency, it's virtually impossible to just treat it through food alone. You would have to have both. So again, I think it's all about explaining that to the patient and working with the patient. And then that's how you can marry both the diet and the supplements together.
Dietitians need to have an open eye to see what's happening, which leads us to our eighth question. What protocols should dietitians follow when patients experience adverse reactions to supplements, and how can they effectively manage and prevent such occurrences in their patients?
Yes, that's such a good question. The first part is part of that patient education, to explain to patients that when they take supplements, that they're not innocuous. Okay, so you can't overdo it. There are certain amounts that we can take and certain amounts we shouldn't take. There might be interactions with other medications. There might be interactions with their illnesses. Having overdoses of vitamin and mineral supplements, for example, could be very detrimental. I'll give you an example. If you're taking too much zinc in the human body can actually interfere with copper absorption. So you have an interference with copper absorption, you're going to develop some sort of copper deficiency, which could lead to very serious complications. So I think it's all about, again, explaining to patients what the dosage is that you're recommending and kind of caution them from going above that because of reasons. It would be the same thing if you were taking medications. If a doctor was telling you to take a certain dosage, you're not going to take more than that or less than that. You're going to be taking that recommended dosage. But I think the most important thing is the follow-up, just like we had mentioned before. You need to get those labs tested. You need to see what challenges the patients might be coming up with. You need to educate the patient as well, and maybe steer them to more of the evidence-based education. If they're going to be scrolling the internet, what sources to actually go to. Because patients do like to do research on their own, and we do encourage that, but we want them to go to reputable sources.
Yeah, of course.
Yeah.
Lovely. Lillian, thank you very much for your information today. It was really very informative. And we will be looking forward to our having you in the Middle East again on our live webinars, and hopefully in person when we go back to in person. Thank you very much, Lillian. It's been a pleasure to have you with us on 8 Questions in 8 Minutes, and we'll be seeing you very soon. Thank you very much.
Thank you so much. My pleasure.